Yeah, I was initially critical of OMIDRIA because of the high cost of the drug. And to me, it was two simple drugs put together. It was phenylephrine and ketorolac in an intracameral form. So how could this little 4 ml vial cost that much? And then also I was worried as a cornea specialist, maybe it would be toxic to the cornea. A lot of times when things are first released, maybe they don't have a full wide release yet to all the population, and maybe there would be some issues with even with the phenylephrine. And at that time I thought, you know what, I'm a good surgeon, I don't need it. And I think a lot of us have made that mistake in the past of thinking that we don't need something and before we even try it. So before I ever even tried it, I had that sort of attitude. But then a lot of my friends who had used it had told me some good things about it, so I decided to give it a try. And I'll be honest, I didn't think it was that great after the first 10 cases. I thought it was okay. But after the next 10 cases and the following 10 cases, then I really saw a difference. And so now I'm doing their second eye and I have OMIDRIA on board, and now that pupil's beautiful. It stayed dilated the entire time. So it just took me some experience to really change my mind. And then as I've gotten to know the product, there is a lot of interesting technology that's in that little vial, so that it doesn't oxidize and it doesn't change its formulation. It's made in a very safe and effective way, FDA guided. It's not compounded. So there are some reasons why that little drop or that little vial costs so much. And there's a lot of R&D put into this product, and I think we do see that in the benefits that it promotes with our patients. So I would describe OMIDRIA to my peers as a really great red zone defense. Assuming that a lot of my peers like football like I do. But you know, if you can march that pupil down smaller and smaller, but stop it at 6 millimeters and keep it from getting all the way to the end zone of 3 millimeters, then that's the best defense that we have in preventing intraoperative miosis. So that's number one. But you also have to remember that it's labeled for postoperative pain reduction too. So it does really help with postoperative pain. Typically cataract surgery is not that painful, and I think we sort of gloss over that fact, but really if you look at the studies in the FDA trial, it did reduce analgesic use. It also reduced post-op complaints of pain. So we use it for both reasons in those cases.